Nathan Fitter. I'm from Pelotas, Brazil, and I am currently working at the University of Queensland, Australia. First of all, I would like to thank you for spending some time on answer the questions I sent you about some months ago. I really appreciate that in name of the University of Pelotas and our team. But as my idea is not to take much of your time, I just want to show you what I have got from that survey. Basically, that survey was one of our current projects. Our main idea is to promote physical activity not only to prevent dementia but also as a non-pharmacological approach to treat it. You might know better than me that dementia is already a public health problem that affects nearly 50 million people worldwide, with this number being expected to triple by 2050. Also, the economic cost of dementia increased as fast as its prevalence, costing more than $1 trillion in the last year. And one of the major problems about dementia is that it's now affecting more people from low and middle income countries than high income countries. Indeed, about 70% of all cases of dementia are housed in low and middle income in countries, low and middle income countries. That might lead, that lead the World Health Organization to develop the Global Action Plan on Public Health Response to Dementia, increasing the awareness of this important health issue. If you take a closer look, it is expected that the number of people aged 60 years or more in Asia increased by 180% from 2000 to 2050, with higher increases in Brazil and Western Sub-Sahara, where the increase will be higher than 500. That demographic and also epidemiological transition will lead to an increase in higher increase in the number of cases of dementia, where we'll have an increase of 116% in high income countries, where we will have an increase for 2050 of 223 in middle income countries, and an increase in dementia prevalence about 264% in low income countries. But that's not all about bad news. We also know that about 50% of all dementia cases are attributable to multiple risk factors such as high blood pressure, diabetes, and physical inactivity, which is not achieve 150 minutes per week or physical activity. And we already know also that physical activity could prevent dementia due to its benefits in cardiorespiratory and cerebrovascular system, and improvement in some neurotrophic factors such as brain-derived neurotrophic factor. In addition, we also know that physical activity and exercise could improve quality of life, functional capacity, cognitive function, and independence level in people with dementia. So when you think about it, you might think which exercise should be better, if you should start to do or recommend walking, running, or strength training. The answer is whichever is possible. So we know that aerobic training will improve cognitive function, especially by regulating hormone levels, reducing oxidative stress, neuroinflammation, reducing the accumulation of A beta protein, increasing synaptic plasticity, and promoting then neurogenesis. Those benefits are primarily induced by increased levels of BDNF in both brain and peripheral blood. Likewise, strength training will promote some of the same benefits primarily by increasing levels of insulin-like growth factor irisine, and then inducing an increase in BDNF. So all this information together led the Brazilian Ministry of Health and the American College of Sports Medicine to recommend physical activity or exercise of any modality to improve cognitive function in patients with dementia. But although the literature shows us some reasons to promote physical activity, that message seems not to be well diffused among dementia associations and national dementia control plan worldwide. So with that survey, we aim to identify the Alzheimer's and other types of dementia associations worldwide that mention and recommend physical activity to prevent and treat dementia. From 123 associations around the world, we received data from 112, which more than 90% of our initial population. We consider physical activity mentioned where we found any of the following terms: any association website, Facebook page, any institutional document, and by answer or short questionnaire sent by email. Besides, we also searched for physical activity recommendation, and at this topic we looked at three. We looked if there was any recommendation, and if it was, how it was, based on fit principle suggested by the American College of Sports Medicine. So if a recommendation just states, for example, do walking 3 times a week, you would have two principles on the recommendation. That is walking, the type, and 3 times a week would be the frequency. And in the below, we have do walking 3 times per week at moderate intensity for 10 minutes or more. So in that case, we have the all 4 principles, that is type, frequency, intensity, and time. So look at our results. We observed that only 33% of our sample mentioned physical activity in their websites, Facebook pages, or in any institutional document. However, when we look for recommendation, only 12.5% of a sample sufficiently recommend physical activity to treat dementia, as exposed in these two graphs here. And when we talk about physical activity promotion, we are talking about a low-cost, feasible, non-pharmacological approach to both prevent and treat several diseases, such as hypertension, diabetes, depression, and dementia. This is important because we know that dementia patients are frequently affected by one or more of these chronic diseases, what lead to higher frequency of hospitalizations, longer hospital stays, increased cognitive and functional decline, and decrease in quality of life. We must then promote physical activity to reduce the risk for those patients being affected by those chronic conditions. And besides that, this could potentially preserve its cognitive function, what might mean a longer period of time just remember the loved one's face. Also, it increases the patient's quality of life and independence level, what might lead to a decrease in dementia-related cost and burden for caregivers that are so affected by that disease. So let's say you are inclined to start to recommend physical activity in your association, or just more motivated to keep doing well done work on the field. So what we should prescribe? Basically, the American College of Sports Medicine, the World Health Organization, and Alzheimer's International Association explained that 150 minutes per week of physical activity is necessary to get the aforementioned activity-related benefits for adults. However, the literature shows us today that even 25 minutes walking one a day could decrease the risk for all-cause mortality and chronic diseases. However, there is no dementia-specific guideline for physical activity, as we have hypertension, diabetes, or Parkinson's disease. That's why we are working hardly to develop the evidence-based document. Sorry. So here we have some examples of sufficient physical activity recommendation for people with dementia in Uganda and in Brazil. So we have in Uganda we have type such as walking, frequency 3 times a week, time 30 minutes per session. And in Brazil we have just the type suggesting stretching exercise, muscular strength training or moderate aerobic training, and the frequency, but we don't have time and intensity. So we might do together. When we think about the burden of the disease for the patient, caregivers, and healthcare, is that what we are talking about when we think about dementia? So in order to reduce that, well-organized working networking need to be set urgently in order to give those affected by the disease a better quality of life, even if that means remember the loved one's face just a little bit longer. So that's it. Thank you very much.